the future of therapy for trauma care is going to be about fusing expertise and combining effective treatments. One of the treatments that you featured, stellate ganglion block, for example, has been described as a cure, and it's not a cure. But what it is an accelerant to really good follow-up care. So one of the things that I've been doing is co-treating patients with physicians who provide that treatment, for example, and other treatments, and combining that with really good high-quality follow-up care, whether through these reunions or retreats, equine therapy. And so it's combining treatments that is really going to get us the best result.
So talk about what you have coming up. You're doing an SGB treatment with some veterans in Chicago, and then immediately you're flying them out to California for a program.
Yeah, I had a realization over the holidays that it's a really hard thing to ask someone to approach what they fear every week for 12 weeks, a standard form of therapy. Therapy is effective, but it's really hard for people to stay engaged in treatment for trauma. So I think we need to shift the model a little bit and make it more like a deployment. So what I'm going to do is we've gotten funding to send a group of veterans all together to get the stellate ganglion block injection all together on the same day, and then fly straight into a really high quality aftercare program that's like wraparound support that has equine therapy and meditation and also therapists and licensed professionals, and I'll be there with them all week to support that. So we've got a team that's coming in to get treatment and a team of providers that have different expertise that are coming to surround them and really help them find what I hope will be a new normal.
And then even after that, there's more things they should do and change in their lives and finding a mission. Talk about how important it is to find a mission.
So it's really important to not just think about keeping people in the fight, but what makes life meaningful? What makes life worth it? What brings us joy? And I think that purpose is a type of wealth that our society really needs to think more deeply about, how we are all pursuing purpose as a type of wealth. And so for veterans especially, they've become used to orienting their lives around the axis of having a mission or having a purpose. And that is what they're telling us over and over is so sorely missed in the transition. And so there are organizations like Team Rubicon is one great example, Team Red, White, and Blue. I just wrote a chapter on disaster response operations that use veterans' skills to help them find a new mission and a new purpose. And in doing that, they form these new tribes after they discharge. And that can be life-saving for some of them. I've been in those circles, and I see what they say about how that can be really life-saving for some of them.